Autoimmune disease is the failure to distinguish self from non-self. There are more than 80 known autoimmune diseases. Autoimmune disease is when T cells are produced that are somehow meant to attack self-antigen, escape detection, and are failed to be destroyed. Myasthenia gravis. Myasthenia comes from the Greek word meaning muscle and abnormal weakness. Gravis, on the other hand, comes from the Latin word meaning serious. This disease targets neuromuscular junction between motor neurons and skeletal muscles. As you could see, in the normal synapse, interaction of the neurotransmitter called acetylcholine and receptor allow sodium-potassium pump action that results in muscle contraction. However, in a person with myasthenia gravis, as you could notice, the receptors are somehow blocked with antibodies, which does not let the acetylcholine bind with the receptor in order for muscle contraction to occur. This disease is characterized by weakness in skeletal muscles, especially the breathing parts and moving parts. Ptosis is a condition wherein the eyelids are drooping, and this is the most common or the most frequent early sign. Affected muscles by this disease become fatigued easily. Effective treatments include drug, which inhibits enzyme that breaks down the acetylcholine, increasing concentration of the neurotransmitter in synapse. And another treatment is through surgical removal of thymus, since it is the site of T lymphocyte maturation. Multiple sclerosis is another autoimmune disease. In this disease, nerve cells in the brain and spinal cord lose their myelin sheath, and therefore the nerve cells cannot conduct impulses anymore. As you could see in the image, this is the normal one, wherein the motor neuron has complete myelin sheath. But in the abnormal one, or the one affected by multiple sclerosis, you could see damage in the myelin sheath. If the myelin sheath is like this, it will be impossible for the nerves to relay instruction as fast as possible. And we call that as a saltatory conduction. And without that saltatory conduction, it will take long for nerve cells to send out a message to the effector. Multiple sclerosis is a random occurrence, and the degenerating areas that we call as plaques are detected by MRI scans. Symptoms include muscle weakness, loss of sensory input from skin, and mental problems. Rheumatoid arthritis. Rheumatoid arthritis affects joints or the area where bones meet. The tendon or the connective tissues between the muscle and the bone become inflamed. There will be constant muscle spasm and pain, and patients find it hard to be mobile. Type 1 diabetes. Type 1 diabetes is known as insulin-dependent or juvenile diabetes. In this type of diabetes, the pancreas, especially the B cells of islet of Langerhans, cannot produce insulin. Blood sugar level cannot be regulated. Therefore, as the person or the patient takes in more glucose, glycogen cannot be created since insulin is absent. A person who is affected by type 1 diabetes has to take in insulin. And as you could see in the image, this is of course the pancreas. And this pancreas has several islets of Langerhans which are divided or categorized into different cells. And these different cells will be responsible for the production of different hormones. And as you could see, the arrows in here are the beta cells. And as you could see, the things that are pointed by the arrows in here are beta cells. And the beta cells are the one responsible for producing insulin. What happens is that white blood cells attack these beta cells. Therefore, there will be no insulin produced anymore. It is said that type 1 diabetes is influenced both by environment and genetics.